Spread out on this kitchen countertop, the snapshots of Daryl Cheer's life. He grew up as part of a close-knit family. As a child, he loved to play sports, and as an adult, he relished being a father to his young son in Edmonton.
All those are him and his son when Jaden was born.
Wendy and Cyril Fleming knew that Daryl smoked pot. They thought that perhaps he'd taken pills a few times before, which is why they talked to him about the dangerous opioids they were hearing so much about.
I asked him 3 weeks before.
Yeah, we heard about it.
About fentanyl. And I said, please promise me you won't touch that. And he said, I promise you, Mom.
3 weeks later, on October 4th, the 24-year-old was discovered dead at a friend's house. A pill was found near him. At first, the family was told he likely died of a fentanyl overdose, but then at the end of October, they learned it was actually Carfentanil, a drug exponentially more toxic.
What was your first thought?
He didn't have a chance. He didn't have a chance.
Because what we've heard of carfentanil is that's 100 times stronger, and they said once he took that pill, it was a death sentence. He didn't have a chance.
Long before Carfentanil ended up on the streets, it was used by veterinarians and those who needed to tranquilize large animals like bison. It's hard to overstate just how dangerous this drug is, so potent that all of the precautions are taken when it's used in the field. Full protective gear, and in case there's a leak, the antidote naloxone is on standby.
Ready to go in case anyone gets exposed.
Nigel Colquitt is a professor of veterinary medicine at the University of Calgary. He's been using Carfentanil since the late 1980s. Its power well understood and feared.
In the veterinary field, there's been a few exposures over the years. Fortunately, we only know of one fatal exposure, but these drugs demand a very high degree of respect.
And to understand Carfentanil, you must first begin at the source. Fentanyl is a synthetic opioid made in 1960. It was designed to be used during surgeries and for severe pain. After it was created, scientists were looking to make other drugs with varying levels of potency, so they experimented with the fentanyl formula by shifting around molecules and adding and taking away atoms. They created new drugs, and one of them is Carfentanil. It was so powerful that it was intended to be used as an anesthetic for large animals, which is why it was so unbelievable when Colquitt heard rumblings last spring that the opioid was making its way into street drugs.
Most of us were in disbelief. We're a small community, people that do zoo and wildlife work. We know the hazards and risks of these drugs because we've been working with them for many years, and the thought that it would actually be out on the street is quite horrifying.
And deadly. When a group of Chechen militants held more than 900 people hostage in a Moscow theater in 2002, Russian special forces pumped in a gas to help end the siege. It's believed to have contained Carfentanil. More than 120 people were killed. Years after it was used as a chemical weapon, it's emerged as a particularly deadly piece of the global opioid epidemic. Fentanyl has been on the public health radar for a number of years, but Carfentanil was thrust into the spotlight only recently. 2 shipments of it were seized at Vancouver's International Mail Centre, and in one case, a kilogram of the powder was found in a printer ink bottle not much larger than this. That package was sent from China and bound for Calgary. There was enough drugs for 50 million lethal doses.
There's some small grains in there.
This isn't an opioid, but Detective Guy Pilon wanted to show me just how minuscule of an amount can be fatal.
That would be enough to kill you.
Police say no one buying drugs on the street asks for Carfentanil, but the opioid is cheap and potent, so it ends up being blended with other drugs and pressed into pills. Some are left with a higher concentration of the opioid than others, which is why for users, really is like a deadly game of Russian roulette.
Why are our drug dealers using it when presumably, they want to keep their clients alive so they can keep buying drugs?
For them, it's economics. They have the drug, they have to sell it. They will sell it to whoever wants to purchase it.
We found the drug available online on a myriad of shady marketplaces on the dark web. For a few $100s, you can order carfentanil in both liquid and powder form. In many cases, the drug appeared to be shipping from China, where it's unregulated. In Canada, carfentanil has been found by police in BC, Manitoba, and Ontario. In Winnipeg, a baby had to be hospitalized after being exposed to the drug. For police, it means every time there's a suspected opioid call, they have to suit up in protective gear.
Fentanyl already changed the program for us. It really upped the ante, and carfentanil is just going to make things even more dangerous for everybody involved.
And because it's deadly in such a small quantity, detecting who has used it is a challenge.
And I think it's fair to say I was probably in denial for a while, that I thought carfentanil is so potent that they would never traffic this because it would kill too many people.
Dr. Graham Jones and his team at Alberta's Medical Examiner's Office have been testing blood samples for fentanyl for 20 years. Early last summer, they started working on a test for carfentanil.
Because it's important to recognize that it's not just a matter of being able to detect it, say, in a powder. We have to be able to detect it at levels like 10 in 3 billion, that sort of, or trillion rather, very, very low concentrations.
In order to be able to do that, they had to develop a new method for testing which would ensure that their equipment could pick up the small traces of the drug. This fall, officials announced that they were the first lab in Canada to be able to test for the drug in blood. The question then became just how many others had died because of carfentanil.
But certainly, it's possible we could have missed carfentanil cases from earlier this year. And that's why we're planning on going back and retesting some of the cases that we've already looked at.
So far in Alberta, carfentanil has been linked to at least 15 deaths, but the picture in other provinces isn't as clear. That's because labs elsewhere are still working to be able to detect the drug in blood.
In Alberta, all of that testing and retesting means caseloads are up, and some families are waiting months to find out just what killed their loved one.
It's actually really frustrating knowing this year was so bad. And now we get to go into the new year and look forward to the toxicology. So it would be nice to just start the new year fresh, but we can't. After the funeral, his friends came up here and put a cross up for him.
Each week, Carol Ann Hillman treks up this now icy hill in Calgary to a wooden cross.
It's a place to come and remember him. To just feel like we're with him.
Her 19-year-old son, Tyler, died of an overdose in July. He went to bed one night and was found by his younger sister in the morning.
He was actually saving money to buy a new car. So I guess that night he had gone on the computer and he was on Kijiji looking at cars, and that's how she found him, was sitting on his bed on the computer.
Tyler had been laid off and was having trouble sleeping. In his room, the family found a pill that said Xanax, a pharmaceutical designed to help with anxiety. In the U.S., authorities have found counterfeit Xanax pills laced with fentanyl. Tyler's mom believes that's what her son took.
You don't think that's gonna happen to you. You think that's something you hear about. I didn't know Tyler was doing anything. How would he have even gotten it? I have no idea where he got them from.
And that's a question so many families are now grappling with. Before Daryl took carfentanil, the Flemings didn't know anything about the drug.
We're learning lots now because we're doing lots of research, but I wouldn't want to see anybody else go through this, that's for sure. I know lots of people are going through it.
And the more you learn, the more it scares you, because we still have kids.
They know firsthand that no one should feel immune. Carfentanil may be the latest opioid to surface, but experts say there will be other variations and new drugs altogether.
He was happy. Loved life.
Inevitably, they too will lead to the same pain and loss felt by so many now. Briar Stewart, CBC News, Bruderheim, Alberta.